Hello everyone. Today we'll talk about further in the Ca cervix. In the earlier sessions, we have talked about the probable causes of Ca cervix, the mode of spread of cervical carcinoma infection, and clinical staging of Ca cervix, that is through Figo's classification. Today we'll talk about the clinical features of Ca cervix. Ca cervix is more common in the women of 40 to 70 years age group. It is also more common in the multipara women. It is not commonly occurring in the nullipara or primipara women. Who is called multipara? The women who has given birth to two alive children, she or more than two children. She is called multipara. So in such women, Ca cervix is more common. In the clinical features, let's first talk about the symptoms of Ca cervix. The very first symptom is irregular vaginal bleeding. These occurs very earlier. So it is the first symptom of Ca cervix. This bleeding occurs at different occasions. So what is the time of vaginal bleeding? First, it is seen post-coital. It occurs after the menopause. Post-coital, hemorrhage is occurring after the coitus. Hemorrhage follows the coitus and hemorrhage may continue for several days after the coitus. So, first occasion is post-coital. It may occur on straining. Hemorrhage occurs on straining. It may occur post-menopausal. Ca cervix is very common cause of bleeding per vagina after the menopause. So bleeding may occur post-menopausal or it may be intermenstrual. The bleeding may occur in between the periods. Sometimes whenever cervical examination is attempted, the vaginal bleeding will at once start. So on simple digital examination of cervix, severe vaginal bleeding will occur. Because cervix bleeds on touch, cervix is very soft. These symptoms you will find in the drugs of therapeutics. When you discuss the therapeutics of Ca cervix, homeopathic medicines, cervix bleeding on touch, very common symptom. Or profuse bleeding per vagina, very common symptom of Ca cervix. Next is discharge per vagina. It is watery and blood stained and the discharge is foul smelling. Now, what causes this discharge? The discharge originates from necrotic areas on the surface of endophytic growth of Ca cervix. This is the origin of discharge. Discharge is more dominant feature than irregular hemorrhage. So, rather than vaginal bleeding, the discharge is more important symptom. The discharge is watery in the postmenopausal women. So watery vaginal discharge is an early symptom in women of postmenopausal age. Next symptom is the pain. It is the late symptom. Pain can be somatic or visceral. Somatic means bodily pain, physical pain, and visceral pain is the organ pain. Somatic pain is the sacral pain radiating to thighs if lumbosacral nerve plexus are involved. It aggravates at night, and the visceral pain is felt as ache or colic from uterus, bladder or rectum. So this pain is the late symptom. Along with these symptoms, the woman can have fever, constitutional symptoms, the WBC count increases and uterine activity increases. Uterus becomes painful, tender. It is little bit enlarged. Along with this symptom, important other symptom is cachexia. Cachexia is loss of weight. It is more common in the advanced cases, in the advanced lesion, along with loss of appetite, headache and sickness. So these are the three associated symptoms of cachexia. So these we talked about the symptoms of Ca cervix. Now we come to the signs. Up to stage 1B, the general health is not affected. Read it as stage 1B. It is mistyped. There is typing mistake. Have you remembered the Staging of Ca cervix. Stage 1 is carcinoma confined to cervix. It is limited to cervix. Cervical growth has not extended beyond the cervix. That is stage 1. Stage 1b is the lesion is greater in the size. In stage 1, it is minimum size lesion. Stage 1b is greater size lesion. So up to stage 1b, the general health is not affected. Anemia and cachexia are seen in the advanced cases. Per vaginal speculum examination will give you certain diagnostic findings. So per vaginal speculum examination is diagnostic in case of Ca cervix. Now what you find on such examination? In the early stage, vascular papillary growth is visible or malignant ulcer is visible. In the advanced stage, vascular growth appears as cauliflower arising from cervix with spread of growth to vagina. So in the advanced stage, from the cervix, the growth spreads up to the vagina. On palpation, cauliflower-like growth is felt friable with indurated base. So when the growth is cauliflower-like, it is friable and the base is indurated. Indurated means hard. So cervix is hard. It is again important symptom of Ca cervix. Uterus is mobile in stage 1 but becomes non-mobile in the advanced stage. So from the stage 1 onward, uterus becomes non-mobile. On palpation of lateral fornices, it shows induration in the advanced stages. That means lateral fornices are indurated in the advanced stages. The bladder base is felt indurated in advanced stages. On rectal examination, you will find induration of uterosacral ligaments and parametrium. Cervical biopsy confirms the clinical diagnosis. So, pap smear, that is the diagnostic examination of the Ca cervix. We'll talk about pap smear next time. So, these were about the clinical features of the Ca cervix. I hope you enjoyed this session. Thank you.